Good morning. Welcome to the first meeting of the Senate Bill 460 Working Group. My name is Kathleen Bahrain. I serve as the Maryland Insurance Commissioner. At the request of Health and Government Operations Committee Chair Jocelyn Pina-Melnick, and in coordination with the leadership of Senator Malcolm Augustine and Delegate Robin Lewis, both of whom are with us today, the Maryland Insurance Administration has formed a working group to address the establishment of the Consumer Health Access Program for mental health and addiction care, as proposed in the form of Senate Bill 460 that was passed by the Senate in 2022. Now, for those of you who were involved in with that bill during the 2022 session, as you are aware, there were some issues and concerns that were raised with respect to that bill. I think it is very, very important to note from the outset that one of the core purposes of the of CHAP is to assist people to navigate the very difficult task of trying to get connected to mental health services that are also covered by whatever health plans they are eligible for. And I believe that there is uniform support. I don't think I have heard anyone question or suggest that that function is not a critical and important function. But there were questions and issues that were raised with regard to other aspects of the bill and other aspects of the program. And the purpose of this working group is to, one, make sure that we have identified what the issues and concerns are. Number two, to have productive, constructive dialogue and conversation about those issues in order to, three, see if we can, or you can, I should say, reach consensus on the critical components with the hope that there will be legislation that can go forward in the next General Assembly in 2023 successfully. So that is our purpose. That is the purpose of the working group. I am very pleased that so many folks who we reached out to were willing to participate in the working group. Our initial task has been to try to make sure that we've identified what the actual issues are that were the subject of concern and disagreement. And to that end, as soon as we formed the working group, we sent out a notice of the meeting of the working group and our purposes, and we also sent out a list of what we understood at the MIA to be the concerns, to give people the opportunity to make sure that we had the full and complete list of those concerns. So part of our purpose and our primary purpose today is to clarify and make sure that indeed the list that we think is the list is actually the full and complete list, number one, and number two, just to introduce the members of the working group and then really talk about what our cadence is going to be and how we're going to go about trying to get to consensus. So with that, and as we get started, let me first begin by introducing the members of the Maryland Insurance Administration staff who will be staffing this working group as we go forward. So first, let me introduce my Chief of Staff, Corey Boone.
Good morning.
Associate Commissioner for Life and Health, David Cooney.
Morning.
Associate Commissioner for Consumer Education and Advocacy, Joy Hatchett.
Good morning.
Associate Commissioner for Market Regulation and Professional Licensing, Mary Quay.
Good morning.
And our Director of Communications, Craig I.
Hello and welcome.
So thank you. And our Principal Counsel, Dan Dorsey.
Morning.
And I apologize. I don't think that I've missed anybody else from the Maryland Insurance Administration, but if I have, shout out. With that, I'm going to turn the mic over to Mr. Boone, who will introduce us to the members of the working group.
Thank you, Commissioner Bahrain, and thank you everyone for joining the work group. I will announce the members of the work group, and I invite you to introduce yourself and the organization you represent. I apologize in advance if I pronounce your name, but I'll surely try. Rivkin.
Hi, everybody. I'm Debbie Rivkin, Vice President, Government Affairs for Carefirst Blue Cross Blue Shield.
Kim Camarada.
Good morning, everyone. Kim Camarada from the Attorney General's Health Education Advocacy Unit.
Neil Karkanis.
Good morning, everyone. Neil Karkanis on behalf of the League of Life and Health Insurers. Pleasure to be here.
Allison Taylor.
Good morning, Allison Taylor, Director of Government Relations for Kaiser Permanente.
Pam Casemeyer.
Hi, Pam Casemeyer, partner with Schwartz, Metz and Wise, and we represent a number of provider interests before the General Assembly and administrative agencies.
Dan Martin.
Hi, everybody. Dan Martin, Senior Director of Public Policy at the Mental Health Association of Maryland. Happy to be here. Thank you.
Ann Seacott.
Good morning, everyone. Ann Seacott with Public Policy Partners. I represent a number of organizations that are members of the Maryland Parity Coalition, including the National Council on Alcoholism and Drug Dependence, the Maryland chapter.
Thank you. Ellen Weber.
Hi, thanks, Corey. I'm Ellen Weber. I'm Senior Vice President for Health Initiatives at the Legal Action Center. The Legal Action Center convenes the Maryland Parity Coalition that has worked very closely with Senator Augustine and Delegate Lewis on SB 460 and HB 517. Thanks for convening this.
Thank you, Ellen. Is more ciphers on? And Quentin Askew, 211. No. And I know Kim Robinson from Cigna and Joe Wynn from United will be a little late today. Isha Yardi.
Hi, everyone. I'm Isha Yardi. I'm a legislative intern for Delegate Pena Melnick, and I'll be representing her on her behalf today. Excited to be here.
And Michelle Tooten.
Hi, everyone. Thanks for having me. Michelle Tooten. I'm an associate professor at the University of Maryland School of Social Work and co-director of our Center for Addiction Research, Education, and Service, or CARES.
Thank you. And Delegate Lewis.
Good morning, everyone. I'm Delegate Robin Lewis. I represent the 46th District here in Baltimore, and I serve on the Health and Government Ops Committee. I'm the House sponsor of the bill, and I'm so grateful to the Commissioner Bahrain and her team at MIA for convening us and doing all of the hard work to help us get to a great result. So thank you.
Thank you, Delegate.
Corey. Hey, Corey.
Yes.
Did you call my name?
I was about to.
Oh, my bad. Because I was like multitasking. I'm so sorry. My fault.
It's all good. Go ahead, Senator Augustine.
Yeah, I'm sorry about that, Corey. Senator Malcolm Augustine, the Senate sponsor of this piece of legislation. I apologize for kind of jumping in there, but I am multitasking. It's a bit of a busy time, but I'm very, very grateful that this has come together and that we're going to work during this interim to really get to some consensus on this just important matter. So thank you to Commissioner Bahrain and to Chair Pena Melnick for making this happen. Thank you.
Thank you, Senator. And Delegate Collison will be joining us later. So I will turn it back over to you, Kathleen. You're muted.
Is Chair Pena Melnick on? I can't tell from the I don't know if there's it says Delegate Jocelyn Pina Melnick, but maybe that's a voice piece. I just wanted to make sure that if someone else from your office or you were there and you wanted to say hello, we gave you the opportunity to do that. All right. Well, in any event, thank you very much. And at this point, what I'd like really to do is to give the sponsors of the legislation the opportunity to talk to us about their vision, their intent, and really address the summary of the program and the component parts of the program. So let me first invite Senator Augustine to share with us his views of and his summary of the purpose of this legislation and the purpose of this program.
Commissioner Bahrain, you outlined it in your opening comments, and I thought that was really quite clear what you said. You identified the issue, the concern that we have, and what this piece of legislation seeks to address. And for it to be a singular voice for those people who are trying to access care that's independent. And at the end of the day, that's what this is about. And I just really, like I said, I was grateful already. You did a really wonderful job of outlining.
Well, thank you, Senator. We've had many discussions, so I'm glad that our notice and my comments were able to capture some of what we've learned from you in those discussions. Delegate Lewis, I want to offer you the same opportunity if you'd like to share sort of your thoughts and views about what this legislation is intended to accomplish, and in particular, if you have thoughts about sort of any of the scope issues that you want to share with folks as we begin that discussion.
Thank you, Commissioner. I want to salute and thank Senator Augustine, my legislative partner in this legislation. It was he who came to me and invited me to work with him on the House side. We have the opportunity to create a statewide program, and I consider myself the voice and the instrument of the collective will here. It's not my job to prescribe what the proposal will ultimately look like. It's my job to trust all of you to bring your very best ideas, your willingness to collaborate, your relentless optimism, because I believe we can do this, we can do this. But what comes out of this work group is going to be the product of your imaginations and your expertise. I just look forward to working with you to get the best product. So thank you.
Thank you, Delegate. We appreciate that. So our next agenda item is really to talk about what are the concerns that have been identified. Again, as we launched into this and spent some time looking through materials that had been submitted before the House hearing, went back and listened to the hearing itself and what people shared and considered at that hearing, thought through some of the discussions and recommendations that the administration, the Maryland Insurance Administration had made, perhaps some of the conversations that HEAU had had. That is what we used to compile this list of this, what we are calling, what we sent out as a preliminary list of issues. And our desire by publishing that in advance was to collect from the members of the working group and frankly, members of the public, any comments they had, not so much about the merits of the issues themselves, because we will be doing deeper dives into that, as David will discuss as we go forward, but making sure that we've sort of identified and we've right-sized what the areas of potential dispute are, and what are the things that we have to bridge as we go through this process. And so when we put all of this together, from my perspective and my team's perspective, it seems as though things kind of fell into three big buckets. One big bucket was looking at the scope of the hub's activities and and a small part of that, but probably a small part of that is where there is overlap with other state agencies. So depending on what the activity is, that may be a bigger issue or a smaller issue. But the key thing was all of the things that the hub and its spokes are intended to do. And because will be open to hearing, to the contrary, if this is a different area, but I have yet to hear one person say that they think that this core element of the program as a navigator connector is a bad idea. And I haven't heard anybody say that that isn't something that is desperately needed, the part of connecting people into care and also addressing the coverage issues around that and helping people to put all of that together. What I have heard people talk about are whether there are other activities that the hub or its spokes would be engaged in terms of legal representation and data collection and analysis and advocacy work, and whether or not those are a necessary part of this funded program. So that's the first bucket. And again, we will talk about the merits of that in its own separate section, right? But today, what we're trying to do is find out, is there stuff we're missing as subject matter? The second bucket, if you will, seemed to fall into, privacy issues. And what is it that state agencies are supposed to provide, under what circumstances? What are the privacy protections that are in place? This entity or this program is not could not itself be subject to HIPAA. So language that says HIPAA as applicable would mean no HIPAA, because HIPAA wouldn't be applicable because it's not a business entity, it's not a provider. So you can make it subject, but our concern at the MIA, was that language that finalized it in the bill didn't do it. Again, we can debate how to do it if there is an intent for that to be the case. But, so that was another issue, is how does the privacy work? How do the permissions work? How do the authorizations work? And what were the use rights under with regard to information that was solicited? And then the third bucket of information really had to do with what is this program? So it seems in the bill, it seems to be a program that is housed within the School of Social Work, but it doesn't have a legal configuration, if you will. It has a defined set of activities which will be carried out by individual entities that are selected by the School of Social Work based on an RFP. So what does that make that from a legal standpoint? So from a number of people have asked, what is it, a state agency? Is it a quasi-state agency? Is it something else? Who do you sue? If you've got the hub and its spokes, is spoke A and spoke B, or how are they related to each other? How do they coordinate? Do they coordinate up through sort of the connector entity? And what are all of those legal rights and all of those legal relationships? And who are the human beings? And what is their relationship to each of those component parts? And then questions were raised with regard to making sure that, as with any entity that is the recipient of state funds, what is the oversight? What are the audit functions? If oftentimes, if you have a program or an organization that is created and is the routine recipient of state funds, there is an OLA audit that function that connects with that. So those kinds of questions were raised. So those are the three buckets that we discerned from our conversations, from our review of what people submitted in terms of written comments, and what we heard when we went back and listened to the hearing. And I fully expect that people will disagree about the merits of those concerns, but we're not going to talk about that today. We're not going to debate whether or not the concern has validity or non-validity, because we will be doing that in our subsequent discussions. What we want to make sure today is that we've level set and we know what the issues are, whether you agree that they're valid or not, do we know what the issues are? And so let me take a moment. I think what I'll do is ask Associate Commissioner Cooney to talk about what our proposed plan of action is and our schedule. And then once you sort of have that big picture of how we're going to spend our summer together, then I think what I'll ask people to do is give us their thoughts and comments about whether or not we have accurately captured the scope of the areas of question or disagreement. So, Mr. Associate Commissioner Cooney.
Thank you, Commissioner. So we before this meeting, we shared the preliminary list of concerns about Senate Bill 460 that the Commissioner just summarized with all the stakeholders, and we asked for written comments in advance of this meeting as to whether we had appropriately identified all the issues of concern and correctly characterized disagreement or objection. So we only received 2 sets of written comments. One was from the Legal Action Center and one was from the Maryland chapter of the National Council on Alcoholism and Drug Dependence. I believe all the work group members should have received copies of the comments yesterday, and we will be posting the comments to the MIA website as well. Neither of those letters identified any additional areas of concern. Instead, the comments focus more on the substance of the concerns previously summarized by the MIA. And as the Commissioner mentioned, we won't be digging into that today. We're really just trying to make sure there's no issues that have been overlooked. So at this point, since we did not receive comments from any other stakeholders, we plan to proceed with the assumption that we have already identified the complete list of issues, unless stakeholders raise additional concerns during today's meeting. Going forward, based on those 3 general categories of concerns we identified, our plan will be to hold 3 separate 1-hour meetings over the next 2 to 3 months to discuss the merits and substance of each concern in detail and attempt to reach consensus on how to address those concerns. We plan to solicit written comments on the substance of each category of concerns in advance of all the meetings, and then members will have an opportunity at those meetings to discuss the concerns and come up with potential solutions. So we'll definitely make every effort to accommodate the schedules of work group members when scheduling these meetings, but it's critical for us to keep this process moving forward. So if a member is not able to attend a particular meeting, it will be especially important for that member to submit any of their comments in writing so that we can still be sure we're considering their concerns during the discussions at the meeting. And as we look at the 3 categories we have so far and looking ahead, it's likely that the topic for the first meeting will be the structure of the program, because all the other concerns, including the best strategies on how to address those issues, really flow from the overarching questions surrounding the exact nature of the program and its governance, et cetera. And then after that first meeting, we'll move on to the scope of the program activities and the privacy concerns. Following those 3 meetings, MIA staff will prepare a summary document based on all the work group discussions with the goal of distributing it to all work group members for further discussion and comment, probably by around mid-September. And then at that time, we can reevaluate whether and how many additional meetings might be necessary. We believe this schedule should still allow for plenty of additional time to make further edits to the proposal if necessary, so that we can ensure we do have a consensus piece of legislation ready well in advance of the 2013 session. And with that, I'll turn it back over to the commissioners so we can go over if there's any public comments.
Thank you very much. And I'll just note that Delegate Colson was able to join us, so welcome to her. So let me open up. So let me open up the floor if you just want to raise your hand. Again, our primary goal for today is to make sure that we have captured what the issues, questions, concerns are. Once again, I am proceeding from the assumption that there is unanimous support for the program in connection with its navigator function and its connection into health plan coverage. And that the issues around the program are the ones that we've outlined. So, and that will be really important, making sure that we have it right as we schedule the remainder of the meetings. As David said, so let me stop there before I say anything more and invite people to comment on the completeness of the issues list, recognizing that when we talk about the merits of those, there will be disagreement on whether those are legitimate concerns, but have we captured what the concerns are? Mr. Karkanis?
Thank you, Commissioner Brain. Yeah, I think y'all have captured the universe of concerns as I know them today. We did get the letters yesterday evening from the other folks and are currently digesting that information. But I just want to say we absolutely support helping people access mental health services. So I think you nailed that, and look forward to working with you all collaboratively to figure out the answers to some of these questions.
Thank you. Other thoughts or comments? Other issues that anyone wants to put on the table? Please speak now, because we want to make sure that as we move forward, we don't hear anybody saying at the end, I didn't have a chance to air my concerns. So Ms. Rivkin?
Yeah, Commissioner, I just want to have the opportunity that in case, as the conversation continues and we start really having a dialogue, there may be other issues that come forward that we want to address. I just want to make sure that we have that opportunity as we hear more from everyone. It may spark some other issues. I want to just ensure that we have that opportunity to add if we need to.
That makes absolute sense. I think that, the working group, sausage making is messy and stuff will come up, and hopefully, and I think everybody's coming at this with, really great intent and desire to see an important, frankly, gap get filled. So I'm sure we'll be able to wrestle through the issues. Delegate Colson?
Thank you, Commissioner, and please forgive my voice. I have caught the cold that seems to be running around the state. And I, tested immediately negative, so we're good. It's funny that we no longer can take a cold for granted, but but we can't. First of all, thank you, team. I want to thank the advocates for working on this. And I'm sorry that I am coming in late, but I'm just wondering if it was covered earlier that there will be an analysis of the current resources and the current processes that we are using so that we can clearly identify the gap. I mean, I have a sense in looking at this legislation from 2022 and looking at and thinking about this work group, sometimes we tend to throw a lot of resources at something without acknowledging what we're currently doing and where they might be falling down or what might else be needed. And so I'm hoping that that will be part of the process that we have as we move forward. And, and I agree that, there's a lot of need for this navigator and for the healthcare coverage. I think too, it's, we also would like to go one step further and say, help people get support when there are issues. How do we direct them there? So that's the other thing I'd like us to think about as we move forward. But thank you all for your efforts.
Well, and just to continue this conversation, we were definitely planning to do that. And frankly, that's one of the reasons why we invited the group from 211 to participate, because they are currently participating. They currently have at least an element of the navigator function. So 211, which is connected with United Way and is a funded organization, Part of what they do, and they've been building, frankly, over the last year, is the development of a connector, if you will, to try to help people get into mental health services. And I am not an expert in, the depth or the breadth of that program, but we did invite them to be part of the working group so that they could share their information on what they're doing, what their current funding is, what their gaps are, where they've been planning to go. And so we had intended to kind of do that as part of the, each of the discussions. So we would get lots of comments, then we would talk to, especially with respect to overlap, we would be talking about what services already exist. However, if you think, and I'm absolutely open to this, I really want to hear what it is that people think, because this is really your working group, we're staffing, right? And by you, I mean the members of the working group, and all of the legislators, of course. So what I would ask is, would it be better to try to start with a level set about, if we hit each of these areas, talk about, this is what is happening in our community already. These are resources that hit these areas, so that then when we tackle each of those subject matters, the only one that probably isn't tied to that is probably structure, but certainly our conversation about structure may be better informed with that baseline, so that it would probably take us several weeks. And I say several weeks, and if Joy were here, she would be kicking my ankle. But it would take us a little bit of time to kind of pull that panel together. But would the working group members and the legislators think that that's a better way to start us and then do the 3 sessions?
From my perspective, it's good to have a working knowledge of where we are before we start building something new. And we know that there are issues. We have, so I'm not minimizing the issues that we have. And clearly we're not meeting the needs. But what are we currently doing that's working? What are we currently doing that's not working? To me, that's a good place to start in helping us to identify the processes and structures we need to fix to fill those gaps. So that's my personal opinion.
I think Ms. Rivkin had her hand up next, so we'll go to her.
Thank you, Commissioner. I totally agree. I think that's a great idea, because we don't know what to fix. We don't know what's broken until we know what's there. The only thing I would ask, if you could add to the list of what already exists, is that I think that it's incumbent upon the carriers to tell you what they do right now in terms of trying to help their members get access. What types of things are they doing? Just so we can get the bigger picture of what's happening from agencies and what's happening internally. I just think that will help us see a bigger picture of what's there.
Then I think Ms. Weber was next.
Thank you, Commissioner Bahrain. We may have jumped the gun, obviously, in submitting some very lengthy comments that identify a whole range of issues, and in fact, identifying some places where we don't think there are issues, because we think that they were really resolved already in the legislation. So we've identified that. One of the things, though, that we also did, because we agree with you entirely that it's very important to identify what's in place so that we can best identify what the gaps are. And our comments really tried to do that. So we created a chart that identified what the activities are that are conducted by the MIA and the HEAU with regard to these different activities that are proposed for CHAP. We welcome people to look at that and update that and revise that, and to clarify if in fact there are items that are missing. We did not include anything that the Department of Health, Maryland Medicaid engages in, because quite frankly, obviously, they did not raise concerns at all during the legislative process. They are not participating in this effort. We fully believe that, again, just as there are gaps in the in the private insurance context. There are many in the Medicaid context. And so, but we did not undertake that. I think one of the other groups, however, I was very interested in knowing about this 211 group. We had never heard about them. And so if there is any information that you can provide that really does identify sort of what activities they are engaged in, we would love to have that so that we can factor all of that in. But the one group that truly is not present at this, and if folks really want to know what's working in communities and what isn't working in communities, then there needs to be a consumer voice as part of the work group. We had fully expected and anticipated, because of your obviously commitment to really addressing and understanding consumer needs, we expected there would be individuals who were involved in and participating. And so we urge you, if you need additional folks, there are people who testified at the hearings, there are folks who participated in this legislative process. We would be happy to help you identify some of those individuals. I think many of them are participating, as part of the public. But that group is essential because it may be very easy for state agencies and the carriers to say what they are doing. But if that is not reaching consumers, and if consumers aren't taking advantage of it, then it is as good as not being available. And as you know from the legislative process, that is one of the key reasons that we have proposed this Consumer Health Access Program, because the existing services, no matter how great they are, and we have no dispute at all as to what HEAU does with regard to these activities and the role that MIA plays in this. Individuals with mental health and substance use disorders in this state are not accessing and using those services. And so that in and of itself is a major gap that has to be filled. And we think that the framework of the program that we've developed is one in which individuals will access this service. And that, I think, is what we're all interested in doing. So I urge you again to bring in members of the community who can be part of this problem identification process and problem resolution process.
So thank you, Ms. Weber. I think that you and several other folks who have been invited to be part of the work group are very capable and able advocates. In addition to that, all members of the public are invited to come to these meetings. And at the end of these meetings, we will hear from them specifically. So, but thank you. And we do have your letter and your comments with regard to the agencies that you did make comparisons of or look at their services. And I do think that's a good baseline that we can build on. Mr. Karkanis, did you have your hand up?
I did, and I'm just sort of reminded by a bunch of other pieces of legislation I've worked on throughout the years. The first question that most legislators ask me is this being done in other states and what's happening around the country? And so I think, I agree with Delegate Cullison's approach of sort of baseline understanding, the world in front of us. But, I think it would help inform this group, if we knew what was happening around the country, if they're doing anything similar, how it interacts with the state agencies in those jurisdictions, if it makes sense, what the overlap is, et cetera.
No, thank you. We appreciate that. We have begun to do some research, again, on that issue. And our initial plan had been to weave these things through our discussions. But what I'm hearing is that there is a consensus around value in doing, I guess, sort of a session that's focused primarily on what other states are doing or other jurisdictions are doing, and what resources currently exist, so that we're clear about what the gaps are. Again, I'm not hearing anybody say that they think that the program is a bad idea or that there isn't a need to facilitate getting people connected to care and to coverage for that care. I haven't heard anybody question that. And that is sort of a core thing. What I'm continuing to hear are what I would think of as more both practical and technical issues around, the nature of the program and whether or not there are at least elements of what the program would do under the proposed legislation that might overlap with other existing resources. So And I expect that there will be robust conversation about whether there is actually overlap and whether, some of the issues that folks have identified are actual issues. So I'm hearing, and let's see, Ms. Seacott has her hand up.
Hi, thanks. I just want to add that while, I think using what the Legal Action Center's put together in terms of, a first look at some of the existing resources and adding to that, I would hope that based on exactly what you said, that everybody recognizes there's still an unmet need, that we're really approaching this from not so much a deficit analysis of, what's, focused on that, about what's not there, but really about what the benefits are to ensuring that people are able to utilize their public or private insurance and access the mental health and substance use services they need. So I just want to make sure that we're very much solution oriented in that way.
Thank you. Ms. Rivkin?
Thank you, Commissioner. I just want to react to what you just said. I want to put a finer point on it. No one disagrees that we want to ensure that people can access services and that there is always improvement on ensuring that people can access services. No one would ever think that that is not the goal that we all have. Whether or not what the correct solution is, I don't know if we all agree today. And that's why I really like the idea, and I'm 100% open-minded, but I really like the idea of starting with what the existing services, because there is a possibility that we find from existing services a way to ensure that people can access the services in a better way without going beyond that. We may decide it's not the right thing, and we do need to bolster with another avenue in some ways of what the bill is requesting. But I don't want to go in with that assumption, because I think when we look at the list and at the whole vision of what's out there, we may be able to make up the existing process better. And so I don't want to go in with any assumptions that we all agree that we have to add something. We may not. We may just have to improve what's already there, and we don't know yet.
Thank you, Ms. Rivkin. I want to hear from Senator Augustine first, and then I'm going to take a pause to introduce Mr. Askew, who was able to join us. 211 is a member of the work group, and he is their representative here today. So Senator Augustine, please.
Thank you, Commissioner Bahrain. We brought this piece of legislation because there's a problem, and I just don't want this to get away from the fact that we know that there is one. That's what this is about. I'm all for understanding what the existing resources are. That's fine. But we also know that people aren't able to access this care. And so I just don't want us to lose sight of that. And I will not have it get sidetracked into something else. Let's stay on track for that. Thank you.
Well, Senator, let me just give you the commitment of the MIA that we will not allow anything to be sidetracked. I do think that it makes sense to have knowledge and to refine not just what the services are, but where they're not being utilized for whatever reason that they may not be utilized. And there are lots of reasons why even really good services and really good methodologies don't get utilized. And then that means you have to rethink how to connect people. So I promise you that we will not slow down, and we will not allow this additional session to take us off track in terms of our timing or our discipline in moving forward. Before I hear from anybody else, I do want to give Mr. Askew the opportunity to introduce himself. And if you would maybe and just to catch you up, Mr. Askew, and thank you for joining. I know that there was a conflict and that's why you were late. We have spent some time talking about what the issues are or seem to be, the disconnects with regard to the whole of the program as it's been was laid out in Senate Bill 460 as it passed the Senate. And one of the discussions we've been having is as to what kind of resources already exist so that we make sure we have a good understanding of what the gaps are as we think about what the goal and the focus of the program is. And I had referenced the fact of the existence of 211 and its connector, if you will, and how it's been building out the capacity to connect individuals with mental health needs to mental health providers. So if you just want to talk a little bit about that, we will have a broader discussion about that in our next session.
Yes, good morning. And hopefully you can hear me. I'm just driving and speaking through my vehicle speakers. But again, my name is Quentin Askew with 211 Maryland. And so by law, we are the Health and Human Service referral line for the state. And so our role across the state is to provide a sort of seamless way for individuals anywhere across the state to be connected to services, behavioral health services, general human services. And by just simply dialing 211, utilizing our website, or by text. And so we have call centers that are across the state that are able to provide easy access to information about resources that individuals might need. That could be anything from behavioral health to employment, to food, to really just understanding what are the resources in their community. And so we over the past several years have been working with our partners through Behavioral Health Administration to, one, better understand the gaps with our behavioral health services and the need to create a more robust database of resources. So we've recently created a specific behavioral health webpage for the Maryland Department of Health Behavioral Health Administration, in addition to our 211 site. And so we have sort of the most robust list of resources across the state. So again, our goal is just to really help to coordinate, eliminate the confusion with accessing services to provide one seamless way to connect.
Thank you, Mr. Askew. As we move forward, we will have the opportunity to, learn more about that program and others, and what its current scope is, and I guess what the vision may be, for it to grow, and what the call center does and what it doesn't do. So I think that we will be, making sure that we circle back with you and give you a time in the next meeting to give us a sort of a fuller sense of what is the human experience when they connect to 211 seeking assistance in getting their child specialty mental health care, and what does that look like for that person, and what you guys are able to do for them and what you're not able to do for them. So I think that'll be very informative for all of us as we think about what this program looks like and what it's connected to. So let me turn to Delegate Collison, and then we'll hear from Ms. Weber.
Thank you, Commissioner. So I just want to add a little bit to Quentin's explanation, only that I think he's too humble in terms of the work that 211 does. I am a huge fan of 211 Maryland. And there, when I was looking through the feedback that was received in preparation for this meeting, one of the things I saw was, numbers less than 50 of people reaching the resources that we have available now to help navigate this whole system. Since 211 Press One has been instituted, hundreds of thousands of people are reached. So again, I just want to say, let's be clear about what we have available and how do we make sure we're using them. And Quentin will tell us more about that when he has the opportunity. But I guess I just wanted to make sure that everyone understood the pretty significant scope of outreach that 211 Maryland has and is constantly increasing. So thank you for letting me say that, Commissioner.
Sure. I mean, there are, my familiarity with the 211 system stems from my work with the United Way and United Women within United Way. And, the 211 resource has existed for a very long time with regard to general human services and connecting people with all kinds of needs. And then more recently, the development of this additional, resource. And I think, we will learn something important from Mr. Askew about what they've been building out and what their plans for the future are. Ms. Weber?
Thank you very much, Commissioner Moraine. I just want to return 1 minute here to the consumer experience, because as much as I appreciate your faith in my ability and the ability of other people on this phone to report to you the consumer experience, that is all that it is. It's reporting what we hear from others. I personally have not needed to seek assistance to find my child mental health or substance use disorder care. And I cannot tell you whether 211 is going to be useful for me. What I can tell you, but you would learn it much better from somebody who's actually been on the receiving end and has sought those services, is that from the experience of other consumer assistance programs, such as CHAP in New York State, they have identified that individuals with mental health and substance use disorders need significantly more hands-on assistance from the very start of their effort than any other population that consumer assistance programs work with. So that's an important piece of information and an important aspect of the CHAP program that has been built in. It is that need for ongoing and intensive levels of support. So that's an important feature that we, again, can't really understand unless there are consumer voices actively here and giving a reality check. And the one other piece of information that, again, I would like to convey to you is there are members of the Parity Coalition who are actually connector entities. And David Stewart, who's the program director of AHEC West that runs the Western Region Navigator connector entity, could not be here today, but he gave us permission to voice his experiences and that of others who work with him. It is at the point in which they refer one of the individuals with whom they have worked to either MIA or HEAU that is the point at which that connection drops. Individuals do not follow through. Now, there may be many reasons for that. But if we're losing people at the very point where they first were involved with a connector entity who helped them enroll and then they came back to them in order to get assistance with a problem, if that connector entity's referral doesn't result in assistance, then that individual is lost to the system.
Ms. Weber, let me just stop for a second because for two things. One, I hear what you're saying. We are going to have that meeting where we're going to have those discussions and you will have the opportunity to say all of those things because and I want to actually hear from the public that's here before the end of this meeting. So about the issues that we've been discussing here, which are focused on, have we missed any issues? And the conversation around, is it valuable to have a session about existing resources? It is a legitimate comment to say that existing resources don't work. That's part of this conversation. And you and other members of the working group will have the opportunity to address why you think they do or do not work and why they're extensive or not. And at every meeting, we will solicit and hear from individual members of the public about their individual experience with that. And that is valuable. And it's valuable. And I think it's valuable because I make it part of every meeting that I ever have. So please do not be concerned that we will not be hearing and listening to what people have to say about their individual experiences, because I agree with you that that's very valuable. But at the same time, we have to have a workable working group and we need to stay on task. And if we talk about, for example, whether or not the CHAP program should be in the form that it's in the statute, or whether, like in New York, CHAP should be part of a particular separate agency with all the legal apparatus that exists in the New York statute, I think that's probably a conversation that makes more sense on those legal issues for a narrower group. And that was our thought process in identifying working group members. So with that, let me take a moment, and I may ask people to be gracious and give us a few extra moments of your time this morning to open up our conversation to folks who are attendees and members of the public. And we'll give anybody who has the desire to speak as to these very specific issues. I promise you, in other meetings, we will get to the merits and you will be heard on the merits. But right now, the two issues that we're discussing today are, number one, whether or not there are questions, issues, concerns about Senate Bill 460 that we haven't captured in our list of issues. So that's number one. So let me stop there and ask if there's anybody who has joined us in the audience who'd like to be heard. If you would, please identify yourself in the chat room, and then Mr. I will move you over and we will hear from you. And I apologize, but it has to be brief. I'm not seeing anyone. Okay, I see one person. Okay.
Okay.
So Ms. Bergen, if you want to bring Ms. Bergen over again, the issue, Ms. Bergen, is whether or not you see issues with Senate Bill 460 that have not yet been identified that should be the topic of conversation. We're not advocating for the bill here. We're really talking about, have we identified the things we need to talk about?
Yeah, I don't have a lot of additional concerns to add. My biggest concern is that we don't have this yet, because I do think there's such a great need for it. But I just do want to echo Ms. Weber's concerns about the lack of direct consumer representation. I think that's a really important piece. And I think that consumers, even in these like very narrow and technical issues, such as legal topics, consumers can participate in that conversation and give really valuable insight that can't necessarily be duplicated by advocates who haven't had that direct experience.
No, I appreciate that. I understand that. And we will give people the opportunity to speak. So there's nothing about any of these sessions that will shut out members of the public for the ability to express their views and their opinions. Now let me.
Pellegrini is next, I believe.
Okay.
Hi, good morning.
Good morning.
I just want to, I'm a provider of substance abuse. My name is Andrea Pellegrini. I'm a provider of substance abuse and mental health services in Maryland. And again, I just want to second what Ms. Weber mentioned. It's so important to have patients and providers actually on this work group, because a lot of times the providers end up being this clarifying source for patients who do not understand what their benefits are and why we do not accept their insurance or where they should go. I just want to add to that. Thank you.
I appreciate that. I think what we've heard, okay, so I appreciate those thoughts and comments, and we are at 11:02. Here's what we're going to do. What we're going to do is we are going to put together a sort of an existing resources session and invite folks to that. We will not allow that to bump our schedule for moving things along and hitting each of those bucket areas. Once we have had a robust discussion about what resources currently exist, it will take us a few weeks to bring those resources together. And what I would ask the members of the working group to do, and members of the public, to identify areas of existing resources that you think ought to be considered by the group. So we will send out a notice to all the members of the working group. We will post it on our website with a date by which we'd like to get your thoughts and views, and the format that we'd like to get them in terms of people we need to hear from about existing resources. And in that same conversation, we will make sure that we also hear from folks about whether those existing resources are actually accessible and usable and what their limits are. So we will hear openly from everybody on all of those points. And then we will, at the same time, begin to post our schedule to talk about the other issues. The first one of which will be what is the appropriate legal structure and existence for what has been proposed as the CHAP, and what should that be, and what kind of governance should it have, what kind of oversight should there be, what sort of kind of audit functions might exist. And that will be the first issue that we tackle, because some of the other issues that may flow from that. So with that, I will invite Senator Augustine and Delegate Lewis, if there are any closing remarks that you would like to make.
Sure. I just am still grateful for the conversation and that we are moving this discussion forward. I really, the one thing that I will also add, and the desire to have sort of, the consumer participation, which I fully agree with, but know that I've shared with you, Commissioner Barain, that I'm one of those consumers myself, and have seen how this just doesn't work. And so I'm grateful for this conversation and grateful to make this better for the people of the state of Maryland. So thank you so very much.
Absolutely. And I'll just say that I share that with you because part of my passion for mental health is the fact that I have mental health professionals in my family. Having worked at Shepherd Pratt, some of my best friends remain in that profession. And I know what I went through as a relatively sophisticated consumer trying to connect some of my relatives into mental health care when they needed it, particularly with regard to geriatric psychiatric care, which is extremely difficult to come by in the state. So I carried my own learned experience, with me into all of these meetings and sessions, as everybody here does. Delegate Lewis, did you have any comments you wanted to make?
Thank you, Commissioner. I echo the wise words of my Senate colleague, Senator Augustine, and say how grateful I am for this work that we're going to do together. I think I would also add that the concerns about an inclusive process are important. And I think this process that we have, the work group with public input, does allow a range of contributions that will be honored and respected. So I look forward to hearing from everyone. And I thank you all again for spending part of your summer with us. Thank you.
Thank you. Ms. Weber, I'm going to ask you to hold it until the next meeting because we are significantly over time, and you can put any comments you like on paper and we will make sure that they are circulated to everyone. We will have out on our website within the next week or so, what our cadence is going to be and when we want to hear the next, get the input from folks about what who we should have participate in the next meeting. But we are 7 minutes over, and I do need to be respectful of my team's time and the time of the others who are on the call. So with that, is there anybody from the MIA that has any comments they want to make as we finish this up? Okay, thank you. With that, I will bring this meeting to a close, and I will look forward to hearing comments in the meantime, and to seeing you all at the next meeting, which we will set up very quickly. We'll do some sort of a doodle poll to try to make sure that we get people's calendars as coordinated as we can. So thank you. Take care.